I've been working with the CVS Health organization for about 5 years now, and just really looking forward to be able to share some practical information with you all today about how you can make a difference in your organizations when it comes to wellness and mindfulness, because we know that these are areas that a lot of people are struggling with right now.
Thank you, Paula. So let's go to the next slide. So, this is a time of seismic change. It's time for culture change, shifting, enhancing what we're doing in our workplaces around mental health. So we'll start with some grounding and talk about the mental health continuum that, by the way, we're all on, and what employers are prioritizing this year and beyond this year. And then we'll go into some tactical strategies that we hope you can take back to your workplaces to either start discussions or hopefully implement. And just, I wanted to also say that employers everywhere are facing this need to create a future that meets these employees' mental health needs. And they know that doing so is critical to business success, that it's a must-have now and no longer a nice-to-have. They know it's required both to compete effectively for talent and to also help employees thrive. And they know the events of the past couple of years have amplified the urgency around the need for stronger workplace mental health initiatives and culture building. But the unanswered question is around the how, and how do workplaces build this culture? So we hope that we can, really help with that today and share some valuable support and resources. If we go to the next slide. So this is the continuum that we're all on at some point in our life. And it's a continuum of experiences, from the 1 in 5 employees who manages a diagnosable condition in any given year to the 60% of employees who reported symptoms of a mental health condition in the past year. Every employee in your population exists somewhere on this continuum of mental health. So one's ability to move up and down that continuum depends on not only their coping skills, but also the level of supports they have in their life, and also their own awareness that something may be going on. And the key, especially in a workplace, is to make sure everyone thinks about their mental well-being in the same way we think about our physical well-being. And as an employer, excuse me, think about what steps can be taken to promote a culture where everyone does begin to consider their overall well-being and not just their physical well-being, and even goes as far as to say that mental well-being is the foundation for all well-being. At CVS, we believe that, and we always say that we're a head-first company because of that very concept. So it's very important to keep this in mind as you build out a strategy or culture around mental well-being. Next slide. So we're gonna throw a poll question up. If everybody can engage and answer the first question. I think Nicole's gonna put it up for us. There we go. Does your workplace culture take into consideration employees' mental well-being? So just choose one of these. Yes, you are doing this, and it continues to be part of the culture. Somewhat, you may have started during the pandemic, but you think you could do more, or no, not really. And I'm not sure if we're getting just a minute to answer. There we go. Okay, perfect. Thank you. So it looks like, yes, we're seeing a lot of employers that are doing this, and somewhat. Looks like it's almost even there. So I'm glad to see there's no's. There's not any no's, so that's great. All right. So I just wanted to kind of ground us with those questions and just be thinking about these questions as we go through the rest of the deck. So the next slide, if we could move forward. Okay, so, and if you could click it one more time. There we go. So these 6 interrelated trends for employers in 2022 are really driving change in benefits and wellness planning, and the trends are here to stay. So they're not going anywhere. This will impact the cost structure of companies, the way it will shape the employer-employee relationship for years to come, around retention and recruitment efforts. A lot of people are looking at these things right now. So these are the ones that have surfaced recently, and they're not going anywhere. So we really need to pay attention to these. And of course, our focus today, sorry, is the circle trend in the middle there, prioritizing mental well-being. So most employers are adding either new mental health benefits due to the impact of the pandemic, or they're expanding what they have, or they're enhancing what they have. So if we go to the next slide, I want to break that down a little bit more. So under the umbrella of mental well-being, this breaks down 2 key areas that employers want to focus on within that priority, and that's to increase access and improve culture. And I want to highlight the culture side since that's our focus today. You'll see the trend there over the last 3 years is increasing in various strategies, with the top priority being manager training. And I can personally attest to this in my former role as a wellness manager working with employers. I saw a steady rise in this, especially through the pandemic and after the pandemic. Managers just don't know what to do, and they are getting hit left and right because they're kind of that frontline person that their team members are coming to, and they just don't know what to do. So I'm really seeing an increase personally, but this is obviously in the data as well. And there's also more interest around anti-stigma campaigns like Stamp Out Stigma, for example, flexible work schedules, and then peer employee training. Like mental health first aid is an example, but there's other trainings out there, and there's even talk, like peer support groups and buddy systems around mental health. And I also want to share one statistic that I was doing some research from a Deloitte study, that the median yearly ROI on workplace mental health programs is 162%. So that just shows us that no matter what we're doing to invest in mental health in our workplaces, it will create a positive return if it's done effectively, of course. So moving on to the next slide. So this is a framework from Mindshare Partners, and it outlines the key elements of a company culture that supports mental health. And you can use this to really broaden what workplace mental health means to you and your leadership and your people. You can use it to understand how your workplace is currently supporting mental health. You can use it to identify what's missing and if there's any opportunities to grow a more comprehensive support system around mental health. You can also use it to understand how mental health affects all levels of the organization and how all levels need to be involved. And in using frameworks like this, I also put another one in the appendix from Workplace Mental Health Institute, if you want to check that one out. But in using these kind of frameworks and possibly putting a business case together, think about what you can do as an individual, no matter what your role or level in the organization is. Because we can't just rely on the workplace. Oh, my workplace is going to handle it, or leadership. We have to do our part too. And as you think about your evolving understanding around workplace mental well-being, think about your vision and what your contribution could look like in changing or shifting that culture within your organization. Because again, it's not just about leadership pushing down initiatives. We need to change the way we think, and we need to change and actually evaluate what we do as individuals. And I want to share a quick example. I went through Mindshare Partner Institute's Mental Health Champion certification program a couple of years ago, right at the beginning of COVID. Highly recommend, quick plug for them. I went through this, and it was the most amazing certification program, and it had such impact for me in my consultant role at the time, but also what could I do as an individual among 300,000 employees at CVS Health, Aetna. This is a huge company. And if you ever second guess yourself, if you can make a difference or an impact, listen to this. I'm low on the totem pole in 300,000 employees. You just get lost in that sea, right? But I was determined to put an action plan together from this certification program. And I had three goals. One was to, what can I do? Low-hanging fruit. What can I do to make a difference, maybe on my team or my department or my market? And what we did is we implemented a few things, mindfulness practices in front of every meeting, having well-being tips added to all of our meetings, talking to management about sharing their vulnerabilities and storytelling. These things started to happen and really shift just our team culture, if nothing else, our market culture. And then I wanted to pilot a manager training. I wanted to do a mental health management training, and we piloted it with because we have a lot of internal resources to support that. So we built this training program, we implemented it, piloted it. Now it's expanding to other markets. And now as of 2023, we are going to be adding that as a product in our EAP program. So that's just from one little person. And I'm not tooting my own horn. I'm just telling you that you can do this too. And the last thing I did was I started our mental well-being CRG here at CVS Health, which now has several thousand colleagues that have joined since last year. So that is just an example of what you can do. So this is the framework, and then what your organizations can do to support workplace mental health. So now for the how. So Paula is going to share with us some strategies and ideas on how to build that culture. These have been compiled from research over the past couple of years on best practices, unique ideas that have been shared from various experts and resources. And when you go through these, when Paula goes through these, think about what you may already be doing. What is that low-hanging fruit that you can possibly implement quickly? And then what is that higher reach that maybe you would like to do, but you might make it a longer-term strategy? So Paula?
Thank you. So as Racheal shared, again, there's many different components of where we can implement some of these strategies within your company. And so one of those areas specifically where you can start to work on just, again, increasing, building that mentally healthy culture is in terms of communication and education. And this can be a really tricky place. And I say that only because sometimes companies may either have a tendency to over communicate, where they're sending so much information that employees are just bombarded and they're not really sure how to access anything. Or sometimes it goes to the opposite end of the spectrum where people are under communicating. So we've got all these great resources available and no one is really taking advantage of them because they're just unaware that they're there. And so some of the things that we have listed here, I'm just going to touch on a few of them, but just specifically, one of the most underutilized resources within many companies are their employee assistance programs. Oftentimes, these programs are no cost to the employees. They're not linked to any type of insurance benefit, but employees are not aware of that. They're not aware of how that works. They're not aware that it's available. And so this is a place where communicating not only that this is a benefit that's available maybe during hiring events or when it's time to sign up for benefits, but making sure that throughout the year, employees are aware that these are benefits that are available to them. And again, that they're at no cost. One of the things specifically when we're talking about creating communication is maybe making it very specific. So we may know that, people are dealing with burnout or people are dealing with, specific struggles, but when the communication is going out, does it reflect that? So are there flyers in your company posted places or sent out virtually that maybe have verbiage that say, are you struggling with depression? If so, go here. Are you struggling with feeling burnt out? If so, go here. Again, that helps to make it really easy because it's capturing that employee in a place where it's catching their attention. Because if that's something that they're dealing with, since it's not buried in a sea of other communication, we're hoping that it would be helpful that they can see, okay, this is specifically for me, and it sends them exactly to where they need to go, rather than them having to filter through a sea of possibly great benefits, but just not really knowing how to navigate. So just being intentional, especially when you're sending out communication, to make sure that the message or what you want to reach your employee is not getting lost because there's so much communication that's happening. So another area specifically is also in policies and initiatives. And we know, depending again on the size of your organization, there might be very little that can be done to change policy, or there might be a lot that can be done to change policy. One of the things we talk about, just again, a mentally healthy culture, and encouraging people really to utilize PTO. Unfortunately, here in America, PTO is underutilized almost less than every other country in the world. And we see that we have higher burnout rates than a lot of other countries. And so if a policy is in place where employees don't feel like they're going to be penalized for taking time off, or maybe even, here at CVS during the summer months, we have something that we call Focus Fridays. What that allows for is a half a day on Friday after 12 p.m. where there are no meetings scheduled. If it can be avoided, of course, in emergency scenarios, you would need one. Or if there are meetings scheduled, there's no pressure to be on camera. It kind of gives people time really to focus in and get their work done so that it doesn't feel like the rest of the week where it's just going, and no one's getting a break. And, Racheal also spoke to the fact that employee resource groups can be a huge and powerful tool because it really is a peer support. But if it's built into something that the company is doing, then an employee doesn't feel like, hey, I have to do this by myself off the side of my desk. So these are just small areas. Again, it seems like a lot of your companies based on the poll are already doing things. So just taking into consideration some of these suggestions and seeing, is there ways that we can enhance what we're already doing or maybe add to it to make those things better? So we can go on to the next slide. And on this slide, it talks again, specifically to managers. Managers have, in my opinion, one of the toughest roles in the company because again, you're right in the middle. You're right in between the people who are giving the directives, but you're right above the people who are having to implement these things and living out in real life what's happening on a day-to-day. And so as a leader, it's important that leaders feel supported. And so as a company, having maybe a management training or something that's happening quarterly that specifically speaks to mental wellness or mindfulness. Again, depending on the type of organization that you have, managers may or may not have this specific experience. And so anytime you can arm them with additional information, that will help them hopefully to feel more competent when they have situations arise. Because unfortunately, in 2022, mental wellness goes hand in hand no matter what position you're working in, no matter what company you're working in, because you will have to, or your employees will be affected by it if nothing is done. And so again, we've got some additional suggestions here where we want to integrate things across departments. Sometimes you may have something really great happening in one department, but no other departments are using it. So maybe there's an opportunity within your company that if you see one department doing something really well, that leaders can work together to implement that across other departments so that everyone feels supported and it's not siloed in certain parts of the company, but across organizations. And then lastly, we have here, in terms of meeting integration, I don't know how your days go, but most of mine are filled with back-to-back meetings. And so sometimes something as quick as just starting a meeting with a mindfulness practice, doing a poll, not jumping right into business, it gives people an opportunity to just kind of catch their breath, hopefully, in between meetings, but then also just giving you time to connect. Of course, when we're working, we're there where we want to be as productive as possible, but not taking into consideration how slowing down can actually help us to be more effective is something that can often get lost. And so we just want to be sure that, again, we don't continue in these patterns where our days are filled with meetings and we're not actually stopping and pausing and being really intentional about checking in with people about how they're feeling and how that's affecting them, even throughout their day and just throughout their work in general. And so we can go on to the next slide. And so we talked specifically about, again, areas of communication, policies, and management. And so these are just a list of some other strategies. It was really nice to hear when the person from Tampa Well shared that, they were working on a community garden. So there's different aspects of therapy that can be implemented in different work cultures. Even having animals come on site, pet therapy has been proven to be very helpful. I know now a lot of people are working remotely, so that might not work out the same way. But having activities and events where people can get out, or maybe they can do things that are a little bit more tactile. They don't have to be behind a desk, but they actually get to interact either with other people or nature can be really helpful. And then again, just having availability for people to do things that are not their regular, typical things that they would do in their workday to give them an opportunity just to debrief. So even things like book clubs or documentary viewings, it doesn't seem like it would be work related, but it gives people an opportunity to maybe focus on things that they enjoy outside of work, but it can help with improving, again, overall workplace mental wellness and just well-being in general. So you can go on to the next slide, and I'm going to kick it back to Racheal. She's going to speak a little bit to some specific mindfulness practices and ways you can build that into your culture.
Thanks, Paula. So we wanted to highlight how to build a mindfulness culture because, yes, it's under the mental well-being umbrella, but it is somewhat different in some considerations that you have to think about, just because, mindfulness is becoming more mainstream, more of a tool that people are using and talking about. It's becoming more normalized and socialized. But adding it into a workplace strategy or culture can be a little bit tricky. So I just wanted to throw some tips up here. And a lot of it is similar to building a wellness strategy or a mental health strategy, but just kind of keeping in mind a little bit of the differences. Obviously building it into your mental health strategy or well-being strategy and building it to the way you do business by integrating it to meetings and having different programmatic elements to it, connecting it back to your values and goals. We had a chief mindfulness officer a few years ago. He's no longer with our company, but that was the time that our culture really shifted to a mindfulness one. If anybody knows anything about Aetna, we were in the news all the time for several years being a mindful workplace because of his work and because of the team. And then he started the ambassador program that I'm a part of now. And it's continuing to grow. I think we have like 80 ambassadors in our company that do what I do with mindfulness practices and education. So that's huge. We have a hub dedicated to mindfulness where all the resources are listed. We have ongoing live guided practices 3 times or 4 times a week. We have one educational session, which is more of a slide deck and really explains the benefits and myths and just an introduction to mindfulness, and then does a little brief practice. So anybody can kind of jump into those calls throughout the company. And, talking about it as a tool for mental health, mental well-being. It's just one tool among many, but it is something that can work for many, many people. And under the communications, obviously you can see a bunch of different ideas there. The one thing I want to highlight there is that, unlike mental health, mental health, you have to look at the language a little bit and how you communicate it. But mindfulness is really key in how you communicate, the language you use around it. So making it universal, non-secular, very compelling. You can even use words like resilience and thriving, less metaphysical language, that will maybe the skeptics that are out there may turn them off. A way of life, a way of being, a tool, like I said. So, and don't make it feel forced, adding it into all your wellness and mental health communications. And one really awesome tactic that we've done as a company, as big as we are, and on local levels with our local work sites, we've done mindfulness rooms. We've also done focus days or a week of mindfulness, including a mindfulness challenge. That could be a week long, it could be a month long. We've had different ones. But the day that we've done had included, it was on site when we were on site before COVID, but it did include, different guest speakers and a community mindfulness teachers coming in. It was amazing. Visibility tables, people come up and ask questions. And then, one thing that our chief mindfulness officer, I always remember him saying was, with mindfulness, building it into a workplace culture, you have to do it as best you can, do it right the first time, because you can, especially with skeptics around this, you can lose their trust and you might not get back that trust for a few years. That's what he said. And then the last one is subsidizing a mindfulness app. So they have a tool that they can actually practice. If you don't have a hub like we're able to do, where you can go to our hub and practice anytime you want. If not, you can subsidize a mindfulness app so they can practice. So that's a little bit about building a mindfulness culture. If we can go to the next slide. This is a chat question. So if you can please go to your chat and answer this question. What is one strategy that you think you can start between now and 3 to 6 months? After all that you've heard me and Paula talk about, all the different ideas, and we kind of brain dumped on you, is a ton of ideas, I know, categorized into some different areas. But what are some strategies, or maybe just list one strategy that really stood out to you, that you really liked, or that you think you could maybe do between now and 3 to 6 months? And as you're thinking about that, there's 3 questions that I'd like you to think about once you decide what that strategy is. I would even encourage you to write it down, because we all know writing stuff down is more likely that it might happen. So how will you know you're successful with this strategy? Is it sustainable? And think about what potential roadblocks or barriers you might have in putting this plan in place. I'll also put we also have a resources slide in the appendix that you can access in case you want to do some more research. It's a lot of great resources, like sources of truth around this topic, that you can use if you wanted to build a business case. All right, let's see if we have anybody. Okay, implementing mindfulness Mondays, love it. Mental health champion group. Okay, letting know staff is what is offered through EAP, very, very important, as Paula said. Start with a simple mindfulness practice, yes. Mindfulness Mondays. Keep chatting in, because we would love to capture all of your feedback. Thank you for doing that. I think we should move on to the next slide. I'm going to turn it back over to Paula, actually, to share some information on who you should seek out for care and how.
Sure. So as you all think about, ways that you can implement different strategies, kind of taking a step back, even just from an organizational standpoint, but just putting yourself in the standpoint as maybe somebody who you yourself might be struggling to say, if I'm having challenges with my own mental well-being or my own mental wellness, because really in order to help others, we have to be in a pretty good place ourselves to be able to encourage and support others. And so when you think about, we've compared, throughout this conversation, we've compared physical well-being. And when you think about physical well-being, I like to use the example of if a person cut their finger, depending on how deep that cut is, or, maybe how not deep it is, they know, if it's not too bad, I can get a Band-Aid, I can put a Band-Aid on it and I'll be fine. I don't need to go anywhere. But if that cut gets pretty deep, they know, hey, I might need to go to an urgent care. And if it's so bad that they need stitches, they know, hey, I should probably get to an emergency room. Unfortunately, we don't have a culture where when we have mental well-being or mental wellness challenges, that it's the same kind of thought process. Oftentimes we may struggle and we're like, I don't know where I should go. I don't know who I should talk to. I don't even know if I need to talk to anyone. And so this slide is really just meant to help to kind of help people to see and navigate just the differences between different types of mental health professionals, but then also to take into consideration that sometimes professional support or assistance is not always needed. And there are things that we can do on our own or just with the support of family members or friends or peers. And so I just wanted to highlight here on this slide that typically when it comes to mental wellness or mental well-being, there are three types of providers that most people will hear used interchangeably, which are a psychiatrist, a psychologist, and like a therapist or a counselor. These are three very different types of licensures, as well as what they do oftentimes is very different. And so just wanted to highlight here that for most psychiatrists, if somebody is in need of, medication management, they are struggling to the point where they maybe have seen a therapist, or maybe they've tried utilizing friends and family and it's just not working out. If something escalated to the point of them needing to actually seek out possibly getting medication, a psychiatrist would be the person who would identify and provide that medication for them. A psychologist, again, often interchanged with a psychiatrist, but very different. They typically do testing and assessments. So I like to use this to say, maybe somebody is struggling with maybe just focusing at work and you're not sure, do I have some type of disability, maybe a learning disability, or maybe I don't know what's happening and I don't know where to go to figure that out. A psychologist could help with providing that type of testing. Usually the testing that they do is pretty intensive. So it's not just them asking you a few questions, but it's usually a combination of questionnaires and assessments, as well as them actually doing a talking session with you. So those can take a couple of hours. Psychologists cannot prescribe medication. So even if they were able to identify an issue or a concern, they would usually refer you to a psychiatrist if you needed medication, or possibly to a different type of provider if you wanted to continue with ongoing treatment. And then last but not least, I don't want to say the lowest person on the spectrum, but in terms of ability to prescribe medication, a therapist would fall to the lower level of that, only because a therapist cannot prescribe any type of medication. Therapy is usually including only talk therapy or behavioral types of therapy. So again, this would be a good starting place as well. If somebody is just like, I'm not really sure if I need to talk to somebody, not really sure if I need medication, a therapist is somebody who you could go to. And if they felt like, whatever it is that a person is struggling with warranted medication or additional testing, they could also refer you to a psychiatrist or to a psychologist. And so you'll even notice here that the typical lengths of time that you would meet with these people would differ depending on just whatever it is that you're dealing with at the time. But as I shared before, professional help is not always needed. And really the way that you can kind of determine, do I need professional help, or probably could I handle this on my own, maybe just with some supports? I always say start with the lower level first. So meaning go to your supports or try and look at some self-care options. And some of those things nowadays, thankfully, we have lots of apps that can help. We know Racheal spoke to mindfulness apps. And sometimes it just requires some changes in what we're doing on a day-to-day basis. And so some of the things just as self-care options that maybe we could try and utilize as a first step before determining, hey, I might need to go seek professional assistance, would be maybe just planning out our time better. There is a million things happening on a day-to-day now. And a lot of times what often gets lost in that is that it creates anxiety in a lot of people just because they're moving so fast. And so sometimes just slowing down and actually being more intentional about what you're doing with your time, you'd be surprised what a big difference that can have, not only on you and your schedule, but on your overall mood and well-being. And so likewise, just listening to yourself. Again, there are so many things to stop us from getting the proper rest, from eating nutritious food, from even going outside. Here in Florida specifically, we've got pretty nice weather most of the year. but you'd be surprised to know that a lot of people actually have vitamin D deficiencies here in the state. That's the Sunshine State, because they do not go outside. They don't engage in things that can, again, help with improving their well-being. And then just lastly here, I'll highlight just also expressing gratitude. This is something that seems so very small, but there is so many studies that show that a person who is just expressive or spends time meditating on the things that they're grateful for or things that they can be thankful for on a consistent basis, that overall it can be a huge improvement to their mood. And I always give the example, I say sometimes work can be a little bit stressful, but when you flip that on its head and you think about it from from a place of gratitude, the way that you could think about that is, you know what? Yes, my job might be a little bit stressful today, but I'm thankful that I have a job, because there's a lot of people who maybe wish that they did and they're not as fortunate. So sometimes just even reframing our thoughts and doing so on a consistent basis can be really helpful. But if you're noticing that, you know, you've tried some practical steps to help yourself and you're still really struggling or having the challenges, then definitely we would encourage you or your coworkers to seek support. And so these are some areas where we can even help managers within companies to just understand that there's a lot of resources out there, but again, not as easy to navigate sometimes when it comes to mental well-being resources as it is for physical health resources. And so we can go on to the next slide. I'll just spend a little bit of time here because I actually wanted to highlight one of the more recent resources that's been introduced in the Tampa community. Here at CVS Health, we recognized even before the pandemic that mental wellness, mental well-being was a challenge in the community. And as we just shared about the navigation, we wanted to create a place where, you know, people already have CVSs in their community. They could walk into a CVS and know, hey, the same way I had gone to a CVS and receive, you know, pharmacy or pick up some retail items, that if I'm struggling or maybe just having a mental wellness question, there's actually now in the Tampa area licensed counselors, licensed clinicians inside of CVS locations. And so what that means, again, we wanted to create access for people. We didn't want to have barriers. These therapists are actually in network with most insurance payers. They're also in network with many EAP providers, as well as we do take cash. So even if somebody has no access to insurance, no access to EAP, they can actually come in and meet with one of our counselors. They can meet with a counselor in person, again, in the Tampa area. And we actually have a slide in the appendix that shows the exact locations where they are, or they can choose to meet with a counselor virtually, regardless of where they are in the state. And so if they were to outreach to our counselors at CVS for an appointment, they would have the option of two types of services. Our care navigation services is, again, kind of that one-stop shop. You're dealing with something, but you just don't know where to go. That's where you would come in. Our providers would do an assessment with you. And if we recognize that, hey, you could probably benefit for some ongoing short-term therapy, we could provide that to you in a CVS or, again, virtually. If we recognize that, you know, you might just need to work on some things on your own, we could give you some recommendations or some other community resources that you could utilize. Or on the opposite end, if we recognize that, hey, you might need a little bit more support than what we can offer in a typical retail space, then we would refer you to one of our partners in the Tampa area who would be able to assist with things such as medication management or other more serious interventions that we were not able to support with. And so I know today, for the purposes of this conversation, we're talking about the Tampa market, but we are located in a few other states. So for any of your companies that might be national, we are located also in New Jersey, Pennsylvania, Texas, Georgia, Illinois, North Carolina, and Connecticut. And something I really love about our program is that we have appointments available in non-traditional hours. So we have early morning appointments, we have late evening appointments. We also have weekend appointments, which is not very typical for most counselors. So again, we want to be available. We want to provide access to folks in the community if they are struggling in the Tampa area or throughout the state. We want you to know that this is a pretty new resource. Again, we went live in 2001. So we're just now moving into our second year, but it is available. And if anyone has any questions, you're more than welcome to reach out afterwards and we can provide you with more information. Or in the appendix slide, there's also information, the website as well as the phone number if you were interested. And so again, there are so many resources in the Tampa Bay area. This is just one of them that we just wanted to share with you today. But I will go ahead, we can move on to the next slide because we're kind of at the end of our presentation. And so we just wanted to thank you all, as well as give you an opportunity, if you did have any questions specifically about, again, implementing some of those practical things that we talked about in your company, or just any questions in general, we would definitely be open to those at this time.
Thank you, Racheal, and thank you, Paula. Once again, if you'd like to send in your questions, we have Nicole also on our line, our vice president, who's managing that for us, and we'll share that with the group to be answered live. Okay, I do not see any questions coming in, which is fine. We'll be available if you'd like to send in questions afterwards. You can send it to contact@Wellness Council TB. Oh, we have a question coming in. Could you share the training that was spoke about earlier?
I believe you're referencing the Mindshare training, if that's correct. It's Mindshare Partners Institute. I did put that in the resources slide in the appendix, the actual website, and you can go on there and see all their different trainings and certifications. They also do leadership trainings too. Yep, thank you, Paula. And it's called Mental Health Champion is the actual certification that I took.
Okay, any other questions or comments?
Okay, I'm seeing a question in the Q&A. Let's see, which one of your programs offered to improve well-being and mental health return the best ROI? For example, lowered A1C or higher employee retention?
I'm trying to read through this. Are you talking about specifically mental health programs? Because if so, I'm not, I can't answer that. I don't have that data in front of me, but I can definitely try to get back to you on that. I'm not sure if I'm understanding the question. If it's specific to our mental health programs or if it's just our wellness programs. We also have our EAP program that has some ROI data. I just don't have it in front of me.
How do you think mental health programming affects retention? I think that might be interesting. Have you seen an impact at Aetna CVS? Anything else in your experience in the field that may show that?
I can definitely speak to that briefly. I know there's been a lot of studies done, like Racheal said, I don't have the information right in front of me, but just even having a background working in employee assistance, many companies are spending millions of dollars to fund programs like this. And it's because there is a lot of evidence and support to show that if a person feels supported at work, especially through their leadership and their management, they're more inclined to stay with the company. Oftentimes people don't quit jobs, they quit supervisors or they quit because the environment is not conducive to them having a healthy work-life balance. And so oftentimes companies will give that as a buzzword and say, oh, we want you to have a healthy work-life balance. But employees are leaving companies right now at a rapid rate because that is not happening in practicality. It is only being used as a buzzword. So it's really important to remember that if an employee is even exhausted, but they feel like they have the support of their management to even be able to verbalize and articulate that, hey, I'm tired, I need to take some time off so that I can feel better, and to feel that support reciprocated, there is tons of research to show that an employee will stay with a company like that well over the fact of going to another company where they don't feel supported. It's a lot easier to walk out on a company if you don't feel like they care about you. And so just even having those options available to employees is important. And that's why it's important to communicate that, because a lot of companies are spending money to have these resources, but the employees are not aware that they're available. And oftentimes, sadly, the management is not even aware that these things are available. So they themselves are not using them, and they're not passing that information on to the employees. But there's a lot of information to support that when an employee genuinely feels that their employer supports them, that they will stay with that company, even though they might be struggling.
Thank you. And I see we have a bit of a follow-up question on ROI and mental health. And I know that's a tough, it's a tough conversation to have at times with leaders, with people in the organization, because it is hard to quantify, how do you go how would you suggest, talking on that subject, when you have a, conversation with a business leader or, in your organization or outside?
I can jump in, or yeah, definitely add to what I say, Paula. But just from my role in working with different companies over the years, just make sure that if it's something you want to do, that like a lot of what we already talked about, but some of those like building a business case with that justification and the research behind it, because the research is there. It's just finding those sources of truth, and I put some in the deck actually in our back of in the appendix, but looking and finding that research that backs up what you're trying to do and building a business case for it is what I've found successful in working with customers and for my personal strategy as well. Paula, what else do you have to add?
No, I think just to add to that briefly, definitely having that support there and putting the dollars behind it. I hate to say that, but sometimes return on investment is only quantified in dollars. And so maybe as leaders, when they see that, hey, retention is costing us this much, turnover is costing us this much, it's easier for them to quantify because there's a lot of productivity that's lost every year because of retention and turnover, because of employee dissatisfaction and mental well-being challenges. So sometimes you just have to match it up dollars for dollars when you're sharing that information so that they can understand, like, guess what? This is causing us to lose money. It may not seem like it, but it is.
And I don't know if you all heard me in a previous slide, I did mention from a Deloitte study that they had looked at the median yearly ROI on kind of the average for ROI on workplace mental health programs, and it was 162%. So it does bring a positive return. It's just, how do we do it? And I think that's the question a lot of employers have.
And how to kind of shift the conversation too, sometimes away from the financial impacts, or like I think you mentioned earlier, it's not just having mental health and well-being program is really not a fun thing to do, or not just an easy thing to give, or it's really a priority in business. And it's I think you could really kind of sell the culture building around it as a key initiative for it.
And one more thing, and then I see other questions, but one more thing I want to add is, going through the pandemic, like I said in the beginning, is a lot of employers are opening their eyes to this more and realizing that it is something that they need to do, not a kind of a nice to have. So I feel like that is helping with our conversations as HR, benefits, wellness people, bringing it to leadership. I think that is only helping us push forward initiatives and building that culture.
I see a question came in, speaking of talent acquisition and retention, are you seeing organizations leverage media outlets to showcase their mental health resources?
I haven't seen where they're doing it externally, but I have seen where a lot of companies are partnering with well-being organizations and kind of using companies that might be already familiar to their companies or to their employees to let them know that, hey, these are things that we have available. So not necessarily externally, but I have seen it happening internally within different organizations.
Looks like there was interest in having this presentation for other community partners or organizations. Is that something you guys are doing now?
This was by request, but not something that we typically do on a regular basis.
Right. And we appreciate you for doing
And
that for
I'll
us.
say, yeah, no problem. We also have our Resources for a Living, which is our EAP. It's more than an EAP program, but it's called Resources for Living. That is it's a standalone product as well. But it also is, any company can purchase different trainings and presentations through Resources for a Living as well. So it wouldn't be us, but it would still be, you know, education and training.
Great.
Steve, I did see a question about a flyer on our health hubs
Yes.
from CBS. So Paula, if you can get that over to Steve, then he can distribute that to everybody.
Yeah, we will be distributing a flyer, slide deck, and a recording of the video, the recording of today's session as well on our website, social media, and likely through our newsletter that we send every month. Any additional questions? Great. Thank you for those chiming in with well wishes.
Thank you so much, everybody. Thank you, Steve. Thank you, Wellness Council of Tampa Bay. We're so glad we got to be able to do this.
Yeah, thank you, Racheal and Paula. It was a pleasure having you and taking the time to do this for us. I think it's very valuable for our community. And we look forward to continuing our efforts to serve the corporate wellness community over the next few months and into the new year. It's going to happen quickly, I know. Please look forward to another webinar, another opportunity to network with one another in the fall, early fall. Be announcing a date, topic soon. Feel free to reach out to the Wellness Council at contact@wellcounciltb.org. If you'd like to present or interested in any topics or connections with others in the community, we're here to help. So thank you everybody for joining today, and I hope you have a really good rest of your day. Take care. Bye.
Great job, guys.